Good morning, everyone. I'm Muriel Bowser. I'm the Mayor of Washington, D.C. Today, I'm providing an update on the district's response to COVID-19. I'm joined by Dr. LaQuandra Nesbitt, the Director of D.C. Health, and Director Chris Rodriguez, who is the Director of DCHCMA. We're going to have a quick update today about vaccination efforts in the district and loosening of phase 2 restrictions, and then we'll have a few moments for your questions. Let me call your attention to our daily metrics, and I'm pleased to say we continue to be out of the red in all of the transmission or the community spread categories. And so that's good news. We continue to ask people, however, to answer the call when DC Health calls. Our remaining red metric has to do with our ability to connect with positive cases. So you'll note that the daily case rate, the rate of transmission, test positivity, and new cases from quarantine are all out of the red. So that is good news. So DC residents, thank you for all that you're doing to adhere to health guidance and to get vaccinated, because it is making a difference. I want to show our most recent vaccination data. So we are reporting over 237,000 DC residents who are partially or fully vaccinated. And let me just refer to the number of the total doses administered are just over 490,000. And we know that growing numbers of DC residents have received their first dose and are fully vaccinated. So again, continue to get vaccinated. We have some good news in the vaccination front as well. This week, we will transition from a registration requirement at our district-run sites or high-capacity sites to walk-up, no appointment needed vaccination sites. So that's beginning this Saturday. This Saturday, of course, is also our day of action, where we're asking volunteers to help us come out and make sure that people are going out to get vaccinated. While we're thrilled that over 200,000 people have been vaccinated, that means that still thousands of DC adults have not. The walk-up vaccination sites are listed here, and I'm going to read them out. Arena Stage, Fort Stanton Recreation Center, Kenilworth Recreation Center, Lamond Recreation Center, Langdon Park Community Center, Providence Health System, Rosedale Recreation Center, Turkey Thicket Recreation Center, the University of the District of Columbia on Connecticut Avenue, Walter E. Washington Convention Center, and the Entertainment and Sports Arena this Saturday, which will transition to the RISE Demonstration Center, also on the St. Elizabeth complex. So days and hours at each of these locations can be found at vaccinefinder.org, and we will, of course, also update coronavirus.dc.gov. As I mentioned, we'll transition from the pre-registration site, and Wednesday, April the 8th, is the last day pre-registration will be accepted through vaccinate.dc.gov. And we also want to remind everybody that children 16 and 17 will receive their vaccinations through Children's National. And you may register your 16 or 17-year-old at childrensnational.org. vaccinationforall.org. And currently, only one of the three approved vaccines is approved for 16 and 17-year-olds. And again, they will be administered at Children's National. We have talked we have talked about a day of action, and this is to encourage every DC resident 16 and older to receive a free COVID vaccine. We're asking volunteers to help us go door to door to encourage residents to receive their free COVID vaccine. So this will start Saturday, May 1st. We will have canvases leaving at 9 a.m., 11 a.m., and 1 p.m. My office is working on routes and locations, and we're asking you if you have a couple hours on Saturday to help the city get back to normal. And we can get back to normal when everybody takes advantage of the free COVID vaccine. We've asked our fraternities and sororities in the area as well to help us be ambassadors. And so please participate in the COVID Day of Action. Next, I want to talk to you about, I think we spoke at the beginning of April and forecasted that if vaccinations and case rates improved at the rate we thought it could, then we would be able to loosen some of our phase 2 restrictions. And I'm pleased to say we are in that position to allow those modifications to take shape on May 1st. So let's go to the next to talk a little bit about those. And as always, these modifications will be made clear in a mayor's order that modifies our phase 2 restrictions. The mayor's order will include the following. The indoor capacity limit for non-essential retail businesses will go from 25% to 50%, or 250 people, whichever is fewer. The number of people for our restaurants and bars, the number of people who can sit at a table increases from 6 people to 10 people. Live music will be allowed outdoors for summer gardens, courtyard dining, and sidewalk cafes that are associated and controlled by a restaurant. If customers are sitting outside, alcohol sales can be made without a requirement to purchase food. Entertainment, multi-purpose facilities, concert venues, theaters may open at 25% up to 500 people, and attendees should be seated. Movie theaters can operate at 25% capacity. For ceremonies and meetings, weddings and special events are allowed indoors and outdoors at 25% capacity. With a waiver requirement if attendance is greater than 250 people, and attendees must remain seated and socially distanced. Regional meetings may also happen to include seated conventions allowed at 25% capacity. A waiver is required if that capacity is greater than 250 people. Fitness and pools, indoor classes can include up to 25 people. Gyms and fitness centers can operate at 50% capacity with a restriction of no more than 250. Public and private pools may open with health and safety plans in place. Hotel pools may open to hotel guests. Outdoor splash pads will be open across the district at full capacity. We continue to encourage people to participate in virtual worship services. And places of worship, however, may admit up to 40% of their capacity for the rooms or area where the worship service is being held. And the total limit includes worshipers, clergy, and staff. All protocols must be followed. Mandatory masking and social distancing must be in place. We're also very pleased to announce a partnership with DC United. The District of Columbia Public Schools has partnered with Audi Field to provide a centralized venue for DC public school graduations to hold safe and joyous events. We're very proud of our seniors. We want to thank them for being so resilient and celebrate them safely. So DCPS high school graduations will be held June 19th through the 24th at Audi Field. There may be some exceptions, but I'm pleased that the Chancellor has worked out a centralized location where we can have all the safety protocols in place. So with that, we continue to encourage DC residents to get vaccinated. Vaccination is becoming easier and easier. You can walk up to a city site. You can schedule an appointment at one of the local pharmacies if you prefer to have an appointment, and local health care providers. Children 16 and 17 can schedule their appointments. Our parents can schedule their appointments with Children's National Medical Center. So with that, we'll take your questions. Yes, sir.
Good morning, Mayor Bowser.
Good morning.
So Maryland today directed providers to resume Johnson & Johnson vaccinations. What's the latest with DC on the J&J vaccine?
I'm going to turn to Dr. Nesbitt. I think that there's some final guidance from the CDC, and that we will wait to get and get the final word on what directions they're going to include with the vaccine.
Thank you, Madam Mayor. As you all may know, the CDC's Advisory Committee on Immunization Practices met on Friday and made a recommendation to the director of the CDC that the pause on the Johnson & Johnson vaccine be lifted. However, there's still some more steps that need to be taken. There's a recommendation for a warning label, and there will be updates to clinical guidance as well as implementation guidance for resuming the use of Johnson & Johnson. Those are expected tomorrow. The district does not anticipate that we will advise people to begin using the vaccine before the clinical guidance information is made available, as well as the distribution plans. I'll remind you all that when we were impacted by the J&J pause, we had about 1,200 or so doses in the district that was under DC Health's control, and that has not impacted our ability to continue to offer a vaccine to everyone who wants one, given the amounts of Moderna and Pfizer. The CDC will not resume ordering and distribution of the Johnson & Johnson vaccine until their final documents are published tomorrow.
Thank you. And then a follow-up question related to the new system and the relaxation, I guess, of the current pre-registration system. What exactly will residents see when they try to register online starting Wednesday? And then can we get some more details about, okay, I guess we're going to learn later about the hours, but will residents be able to get second doses at these clinics?
No. So thank you so much for asking that question. They are for first dose only, and when you attend the site, they will give you your second dose appointment, as well as any information regarded to your need to, let's say you have something pop up at the last minute and you can't make it to that second dose appointment that is pre-scheduled. This is not for anyone who is waiting for a second dose. So they've already received the first dose of Moderna and Pfizer. These walk-up sites are not designed for members of the public to just show up and asking for a second dose of vaccine. That's important because it may cause a frustrating experience for individuals, as some of these sites have different vaccine types than what they may have received initially. We'd also, given that the sites are distributed across the district, they all have different capacities. All of them can give hundreds of vaccines a day. As the mayor mentioned, they're all high-capacity sites. Some of them have the ability to give thousands of doses a day. So it may be advantageous for people to go to the place that is closest to their home. It's the reason why we have encouraged or developed a plan that includes sites distributed in all 8 wards of the district. That ensures that everyone who walks up will increase their likelihood of being vaccinated the day that they walk up.
Thank you. And then with pharmacies, will people still be able to go to pharmacies' websites and make appointments? Like, what's going to happen with pharmacies now with this focus on
Yes, they will
sites?
be able to go, and we encourage you, if you want to have a guaranteed time to schedule it with a pharmacy or with a one of our local medical providers.
Thank you.
Yes, ma'am.
Beatrice Peterson, ABC News. This week is the upcoming joint session of Congress. Are there any plans to increase security in the city around the event?
Chris, do you want to address our posture?
Yeah, thank you for the question. We've been coordinating with the U.S. Secret Service, the U.S. Capitol Police, since the joint session date was announced. I believe it was about a week and a half ago, 2 weeks ago. It is a national special security event, so the U.S. Secret Service on the federal side is the lead coordinating agency. From the district standpoint, the district's Emergency Operations Center will be activated on Wednesday at 4 p.m. This aligns also with the Metropolitan Police Department's Joint Operations Command Center will also be activated. The district will have representatives at all the federal operations centers, including the Multi-Agency Coordination Center, which is run by the Secret Service, which is out in Herndon. So we are in support of the federal government. We are also, from a MPD and Homeland Security standpoint, fully activated for that event.
And a follow-up, DC Statehood passed the House last week. Have you been in touch with any senators or plans to lobby any senators on behalf of DC Statehood?
I will follow the whatever the plan is from Senator Schumer. And we know that with a very strong showing in the House, a very strong showing from the President of the United States, Senator Schumer has indicated that he wants to get this done as not only part of what's important for DC residents, what's important for the American democracy. So we stand ready to do whatever we can to be helpful. Part of our ongoing strategies, you may have noticed on Emancipation Day, that we produced a documentary that it, really it followed some of the comments that I made to the House Oversight Committee. And it was not only shown in DC, but it was shown in markets around the country. All of that is to make sure that we're educating our fellow Americans, the constituents of those senators who need to do the right thing for our democracy. Yes, sir. Good morning.
Following up on the pre-registration, when you go to the walk-up site and you get your first shot and they give you an appointment for your second shot, will it still be at that same location that you got the first shot?
For the majority of locations, yes, because they can be guaranteed that they have the type of vaccine that you're receiving on the first time, on the second time. As you will note, some of our sites are in partnership with other entities like GW or District Urgent Care, et cetera, Providence Health System. Some of those entities may operate multiple sites throughout the district, including on their home campus. However, the preference is for everyone to return back to where you received your dose, which is another way to encourage people to get vaccinated closer to where they live, as opposed to moving across the city.
And Mark, another caveat, there may be some adjustments to accommodate summer camp. And that wouldn't happen until late June, where those sites will just be replaced by another site nearby.
Because they'll be the site of summer camps.
Yes.
Right. A couple of the restaurant and live music, there was, during the conversation with your staff and the council last week, it was mentioned two things that you were considering that you did not mention today, and I'm just wondering if maybe they'll be in the mayor's order, was one, allowing restaurants to serve customers seated at the bar was something that was mentioned as being considered, and also reducing the setback from the stage for live music.
The setback from the stage, I'll double confirm that, and I'm not sure who would have mentioned having bar seating.
So
We're not having bar seating, and we haven't considered it for May 1st.
But you are reducing the setback for stages?
Yes, that's certainly my intention. Let me double check that that's
Okay.
going to happen.
And then, have to ask, I appreciate that you're giving us this information on this dial-up, but when can people expect, without, I know you don't want to get hyper-specific, but when can they expect another dial-up? You know, will there be another one maybe for July 4th or at some point before the end of the summer?
I would say yes, Mark. And we are, and we are very focused on getting people vaccinated, and that's why you see us trying to now encourage. I feel like I'm not speaking for Dr. Nesbitt now, but the people who are early adopters and the early willing, I think, have gotten the vaccine or are getting the vaccine. It's now up to us to make sure that everybody else knows that it's easy, that they're eligible, and that we're pushing them out to the vaccination site. So we have been very focused on getting that done. And to answer your question, I think that we can expect another dial-up. Now, if it's sluggish, if everything I just talked about is sluggish, then it'll be later in the summer. If it's pretty aggressive, then we can have, I think that so far these data coming back are looking like we can turn up activity more.
So you were right on the verge of saying something more specific than later in the summer. If the numbers continue to trend in the right direction, are you thinking, can you give a more specific date, July 4th or sooner?
We've been focused on July 4th. I'll tell you that. But maybe, maybe it'll be even better. And there are small tweaks. We've, with DC Health guidance, have seen that we can turn up things and moderate our infections. Keep in mind, and I've said this many times, and I'll continue to repeat it, the way we get open is to crush the virus and to get people vaccinated. Little tweaks here and there, yes, they can accommodate an industry need, they can accommodate a personal need a little bit, but the way to get all the way back is to crush this virus and get people vaccinated. And so we're trying to do all of those things, moderate the restrictions where they're warranted and safe, but really focus on crushing those numbers of infections and getting people vaccinated.
And my last quick question about the vaccines. For the walk-up sites, what ages are they open to? Are they open to 16 and 17-year-olds, or what is the age limit for people wanting to walk up?
We have focused the walk-up sites to 18 and older, and encourage the 16 and 17-year-old population to be vaccinated through our partnership with Children's National, or where they offer vaccines both on their main campus as well as at the ARC in Southeast DC.
Thank you.
But you do raise a good point, because we don't want to forget about these 16 and 17-year-olds. And we want families to really have this conversation and get their kids vaccinated too. Yes, Amanda.
Thank you, and good afternoon. Some venues and bars just won't reopen at partial capacity, right? They're really waiting for you to lift more coronavirus restrictions. And to your point, you said we can't really reopen like the before times until we crush this virus, or similar to the before times.
I didn't hear the last part of what you just said.
We can't reopen until we crush this virus and get more people vaccinated. I guess I'm wondering, though, at what point in coverage among the population can we start? If you can just kind of offer a plan of when businesses can expect to get at full capacity, just because
I can't.
You can't.
Full capacity?
Or yeah.
Okay, so when you say that, you mean full capacity at the stadium, full capacity at the theaters, full
Right.
capacity. I can't.
You can't say when, yeah.
I can't.
I'm also wondering, for the J&J vaccine, have you noticed a change in behavior since the pause? I'm wondering if people have, you've seen no-shows for appointments, or I'm wondering how it's impacting appointments and such.
We haven't seen a change that wasn't consistent with what we would be expecting. As the mayor mentioned earlier, there are a couple of things that are in play now. The people who were early adopters of the vaccine, who expressed interest in the vaccine very early on, have moved into the system. They've gotten appointments. They've gotten invitation for appointments. And so we started to see, prior to the pause, a decrease on a weekly basis of people pre-registering for appointments. That is not different from the national picture, and the CDC has shown these charts as well, that decreases in vaccine uptake begin to happen before the pause, the Tuesday before last. So we caution anyone from making any statements or decisions to say that the pause has changed vaccine-seeking behavior. We know that those trends would decline over time after early adopters. It's just like any other curve you see for the take up of any new innovation or any new intervention. You've got slow ramp at the beginning, people are kind of trying to figure it out, then you have a huge surge of the people in the middle, and then you sort of get to the tail. So we were in that ramp up of full people who were fully interested. What is important for us to do as a community is to really put this all hands on deck approach in place. The government has been messaging both at the federal level here locally that we need people to get vaccinated. It's our way to get to our new normal. We need people to get vaccinated so that our case rates can continue to decline, that we can protect and preserve the infrastructure of our healthcare system, our public health system, all of those things. We now need that chorus to get even louder of grassroots folks, of neighbors telling neighbors, this is the benefit of getting vaccinated. I did it, you should do it too. It's gonna help our community move along. It's also time for people to start having real talk with their friends to say, hey, I'm only hanging out with vaccinated people, right? So those are the types of things that are gonna move us even further. It's why having the day of action on May 1st is important. It's not just government employees out there. It's gonna be a huge cadre of volunteers. We've asked fraternities and sororities to be engaged. On Friday, I met with 70 leaders from community-based, faith-based, and healthcare organizations in the district that serve our population that still needs to be reached. And we really gotta put all hands on deck. This is a people's movement. It's not just a government's movement.
And my last question, I wonder, I know last week you didn't have a position yet for businesses requiring vaccination to enter. This is for workers and patrons. I wonder, do you think you'll ever? And what's keeping you from making up your mind on calls? I know there's one bar at least who wants to reopen with less coronavirus restrictions if it means if everyone is vaccinated, everyone who steps foot in the bar is vaccinated.
You're I'm not sure I'm asking.
Yeah, sure. Do you have a position yet on requiring vaccination upon entry for businesses? I know you do.
I do not.
And when will you have what's stopping you from making a decision or having a position?
I'm not going to tell a business that they have to have vaccinations to be in operation. I don't anticipate us doing that. What we are focused on in terms of DC government and government services, and that's the discussion you're having. Is that what you're asking me?
So, I know you're not going to require businesses to do this, but I wonder if you would support the idea if it means they could, if a bar wants to, there's one bar in Madams, Oregon that wants to require vaccinations for workers and for patrons. If it means they could reopen with less coronavirus restrictions, the idea is it's more safe, it's less risky, right? Because these are fully vaccinated people. And so I'm wondering if you can get behind an idea like that.
So it's an interesting question in that you're suggesting or inquiring in the question as to whether or not we will set a different set of rules of the road for places that are only open to fully vaccinated individuals. We had the opportunity to engage with a number of experts last week, Dr. Fauci, experts at the CDC, around this notion that you can relax, or it's advisable to relax or have less stringent mask and social distancing guidelines in place if people are only serving fully vaccinated individuals. While there is some interest in being able to expand what fully vaccinated individuals can do, the recommendations are that we still need to have measures and mitigation strategies and restrictions in place in publicly occupied spaces and venues. We need to be still thoughtful about what is considered an appropriate size for a large and mass gathering. So there's a couple of fault lines that should not be crossed in terms of saying that if this bar only opens to fully vaccinated people, it can open with dancing and full capacity and no mask and all of those things. We are not at the place yet where that type of thing is advisable. And I'm only using a bar example because that's the one you provided. It applies across the board.
Yes, Stephanie.
Mayor Bowser, I have an off-topic question,
Okay.
3 in that regard, and then a question for Dr. Nesbitt after,
Okay.
if possible. This is in regard to Fox 5 reporting on 4 officers injured, 2 cruisers destroyed, and this is to do with drag racing in Northeast DC last week. We were told by DC Police that we'd have to file a Freedom of Information request to obtain the traffic report, and I want to ask you, I mean, do you feel that police should be held with higher regard or at a higher standard in this? Will you order the release of that traffic report?
I'll definitely check in with MPD about it, Stephanie. I hadn't been aware of that request or response, but let me speak to the underlying issue. If we had officers who were engaging in this dangerous behavior, it would be, in my view, a dereliction of their duty, and they have to be held accountable. So I know that MPD is undertaking a investigation according to our processes, and we will let you know as that investigation proceeds. But let me get back to you on a report request.
And then, thank you. And then the follow-up, when you speak of, dereliction of duty and they have to be held accountable, I mean, do you feel that just like a citizen behind the wheel caught doing what they were doing, that they're charged immediately, that should happen in this case with the officers driving?
I don't want to speak to the specifics. I don't want to speak to the specifics of, because we have to investigate, but it appears that the facts are what you stated, that we had officers who were using their government property, putting themselves at risk, and obviously putting anybody else on the street at risk, and that's unacceptable.
And then a last question on that. What would you say because there was we had learned of another incident that involved a police van driving officers to the scene of a shooting. This van was apparently going some 90 miles per hour, very high rates of speed, also happening last week. What do you say to the people, the public who are looking at these incidents? They're not learning about it from the police department, and they're saying this is another reason not to trust police.
I'm not aware of the incident you're talking about, so I'm not going to speak to that directly.
Okay. Dr. Nesbitt, a question for you. Can you talk about what you're seeing in the district regarding people hesitant to take that second vaccine?
Sure. We have adherence to second doses that are in the mid-80s, so around 86 to 87% of our residents present for their second dose of vaccine, or individuals vaccinated in the district altogether. We have noted over time that the adherence is very high. In wards 7 and 8, it tends to be lower in wards 2 and 6. But again, all of them are high at or above the national rate.
Yes.
Sorry, just one more. Because it appears that the reporting is that we are seeing now more vaccine than the actual demand. Have there been any cases in the district where vaccines have had to been thrown out because they're not being utilized?
Yeah, so thanks for the question. Last week, I spent all day Friday with colleagues, and I would say the district is not in a situation where we have more supply than demand. We may have reached equilibrium, and we might be at that equilibrium for a little bit. I think what a lot of folks are responding to is we have had the ability to be to move very quickly over the last week or two through people who were in the pre-registration system. That does not mean that there aren't people out in the community who are waiting for an opportunity to go to a walk-up site. Maybe they have problems scheduling things without commitments from friends and loved ones to accommodate them, and they were waiting to be able to just have a flexible opportunity. It doesn't speak to all of the needs that we have to continue to reach people in the community who may not be aware of how easy it is to get a vaccine. They may have heard a lot of the horror stories that were found, that were rare, but displayed prominently in the media, and just say, that's not a system I want to engage with. So what we are now is we're in equilibrium, and it could tip either way. Right? We have a good day on Saturday. We have a good week this week of encouraging people to get vaccinated. We could get back into a space of where demand still outpaces supply, in particular because of the number of people we have vaccinated totally in the district, and the supply of vaccines that we get has not changed substantially. We could tip into supply outpaces demand if we continue to not have people present for vaccination because they're either concerned, don't have a concern, but don't know how to move through the system, or just lack fundamental awareness about the availability of vaccine.
So like if we go back to the number of people vaccinated, 237,000 people have at least been partially vaccinated. We think we have over 500,000 adults in the district. I don't think that number includes the 16 and 17-year-olds.
Yeah.
So there are a lot of people who still need to be vaccinated. Yes, ma'am.
To follow up on that, I understand that data does not include vaccinations that happen outside of the DC area. And we know, is that right? Let me confirm that first.
So it does, but not to the extent that we would prefer. So there is an interchange of where states can send data to each other. The number of doses that have been sent to us there are relatively small. It's more than a handful, but it's still small. It's not sizable. We don't have visibility at the individual patient level on people who were vaccinated by the VA, Bureau of Prisons, et cetera, and we know that there's a sizable amount of adults there. We were able to ascertain some of that data from the CDC, but we're still working through how it impacts our overall vaccination rates. We have to make sure that it's not a duplicate of a dose coming in somewhere else. There are thousands of people who receive their health care at the VA. They've been open to vaccinating everyone, but they don't submit that information to our immunization registry, which is where this analysis comes from. So as we get those processes more refined, as the data moving through what's called the data lake gets better, we could see some increases because we're finding that our residents have been vaccinated ranging anywhere from Maryland to the Virgin Islands.
So yes, this number will be better based on when the data is better. Yes.
So a couple of vaccine follow-ups and then a couple unrelated questions. I'm curious if DC saw success with the walk-up sites last week for seniors that gave you confidence that now is a good time to implement this kind of universal walk-up system.
So we want to get 100% of our seniors vaccinated. We went up a little percentage point or so in terms of those who have been partially or fully vaccinated. Our seniors, that rate is over 70%. It's around 73% or so this week. We also introduced the homebound program last week, and we've gotten, feedback, and we've had substantial inquiries for a long period of time asking when are we going to go vaccinate homebound folks. The first day we had 9 registrants. By the middle of the week we had 40. So use your voice and your access to people to let them know that they can get a homebound vaccination. We actually started doing them on Thursday. But so there's a lot more capacity in that system, and we anticipate that some of the seniors who haven't been vaccinated yet may be homebound or have substantial mobility limitations where this program would prove beneficial. It's not only for seniors, it's for any homebound person.
Right, thank you. And then do people need ID and proof of health insurance to go to the walk-up sites?
They do not, but we continue to ask people who have those documents to bring them. All of these partners are doing this work with very little financial support because they have a commitment to being able to get our population vaccinated. The Federal Center for Medicare and Medicaid Services does reimburse healthcare providers for administering the vaccine. The vaccine is free to everyone, regardless of your healthcare status, but there is some reimbursement that a healthcare provider could get. So we see it as part of everybody doing their part to ensure that we can continue to resource and finance so many of these initiatives by presenting your insurance card and allowing that healthcare provider to receive some reimbursement that helps them pay for the doctors and nurses and medical techs and all of the administrative staff who are working in that clinic.
Thank you so much. And then for Mayor Bowser, the DC ACLU announced today that the DC government is paying $1.6 million to settle 2 lawsuits over police actions during the Trump inauguration protests in 2017. There was allegations that there was mass arrest of protesters without probable cause and excessive force. One aspect of the settlement was that MPD would need to issue a formal directive modifying procedures for processing of arrestees to avoid subjecting them to long waits for basic needs like water and bathroom access. I was going to ask if you could comment on either the settlement or that specific directive.
Well, obviously, I agree to that. I don't really have anything else to say about that in particular, but we've settled the matter.
And then just following up quickly, DC has now paid out substantial amounts for mass arrests at demonstrations, the World Bank, and then as well as the Trump inauguration. The ACLU and other lawyers say it demonstrates a pattern of arresting large numbers of demonstrators without sufficient evidence that they perpetuated indestructive behavior. What changes are you proposing moving forward to avoid similar litigation?
We can talk about that at another time. Yes, sir.
Yes, also off-topic questions. One, do you have any follow-up, any new information, and maybe Director Rodriguez does, on the double pedestrian fatal that occurred near Haynes Point? One, if you know anything about the investigation, and two, I realize that it's federal property and there's little you can do to restrict movement there, but what are your thoughts, about whether or not traffic should be restricted there, like it is in parts of Rock Creek on weekends and times like that?
Well, first of all, it's a devastating crash. 2 people lost their lives. And I know that the National Park Service is investigating. I understand that they quickly found the suspect vehicle and a person driving. I don't know the details yet on the investigation. I assume that it will be considered for criminal negligence or charges, and I will update you further. I expect that we'll have something more detailed to say about it later. You ask about Haynes Point, and I know, Mark, you know it well, as do many people who live in D.C. and around D.C. Personally, I'm a user of Haynes Point quite a lot. So I'm very, I'm saddened that 2 people lost their lives in one of the most beautiful places in our city. So you ask me about restrictions there. I do think that we need to undertake with the Park Service a way to make the park safer for all patrons. You will know, if you're familiar with Haynes Point, that there are tennis courts, there's a golf court, there's picnic area, there's playground, and there's fishing. And there are a lot of people who use the park. And it's only a couple of ways in and out of the park. And it's 3 miles around. So I think a discussion of how we use the park more safely has to consider all of those things.
And then if I could ask you about the Oscars last night, specifically Glenn Close and her shout out to DC specifically and go-go music.
Well, I got a detailed briefing by Dr. Nesbitt about what happened. I woke up in the middle of the night, as I sometimes do, and checked on things. And I thought, this is like, what was this about? And so I think it's a lot of fun. It shows that go-go music is certainly our music, our DC music, our own, but it has penetrated just movie lore, music lore, and it's part of our American experience, and I think that's fun. And to have one of the most celebrated actresses of our time be that familiar with go-go music to do the butt was fun. So finally, and thank you for your questions, Mark and Amanda kind of separately asked and differently asked, but I think your questions went to how can we forecast what comes next? And if you noticed, in April, that's what we did. We forecast. We weren't exactly sure what would happen at the end of the month, but our modeling suggested that with vaccination and with the level of social distancing that we were continue to do, if things went the way we thought they might, then we would be in a position to open up more activity. So that's what our teams will go back and do. We'll look at what vaccinations and infections are doing to see if we're able to forecast sometime in advance. And that is what various industries that have been most impacted by COVID restrictions have asked. If you can give us some time and signal to us what you think might happen, and give us several weeks kind of a runway to get ready for those changes. That's what is helpful to our business operations, and that's what we will continue to do. I always say, however, with a caveat, that if it doesn't happen the way we think it could happen, then those changes would not be able to go into effect. So I say that to say we will likely have another forecast of what future activity could open pending our vaccination levels and infection rates moving in the right direction. Okay, thank you very much.